Hi, my name is Lynsie Mae, and I'm here to talk about the Affordable Care Act and will it increase your premiums? Well, the truth is, we don't really know. And although that might be a little disheartening, it is the truth. But what we can do is look at the facts that we do know to help us establish some trends that we will see in the future. And this I can do. So basically, the reasons that make it really hard to establish whether the Affordable Care Act is increasing our premium cost is a couple factors. It hasn't been fully implemented yet, and cost of healthcare premiums have been going up for the last decade. Now, although we're not in increases that we saw in the early 2000s of like double digits, we still are spending and spending on healthcare, and this is definitely a disturbing trend. USA reports that since 2003, we have spent 80% more on healthcare premiums, while wages have only increased 31%. This is crazy, and shows quite a disturbing trend that has nothing to do with Affordable Care Act and has more to do with medical advancements and what how much we are willing to spend on all these life-saving interventions. It's just has gotten crazy, and this is going to be something that we all need to work together with to find solutions for. Now, lastly, what makes it hard to determine how much of an effect the ACA is having on our healthcare premium costs is that the Affordable Care Act has done a lot to increase the value of our premium dollars. And let me explain this a little bit. So, one of the ways that the Affordable Care Act does this is it has the 80/20 rule. And this means that insurance companies will now be penalized if they spend less than 80% of your premium dollars on your health care. So at least 80% of your premium dollars has to go to your health care costs or improving the quality of your health care. And only 20% can go to administrative costs. Now, this is really important because without this in place, we don't know if premium increases are truly because care costs are going up or just because administration costs are increasing. So this is one way that we're going to start to see a little bit more value for our dollars. Also, another thing is that there's the 10% hike, which means that if an insurance company wants to increase its premium by 10% or more, that it has to be justified to the state that the insurance company resides in. Also, there's going to be more preventative services that must be covered in care plans that are ACA compliant. There are no longer going to be coverage limits. So what this means is one way that insurance companies would keep your premium cost down is say that give you like a lifetime max of $1 million. And when you're shopping for a plan, $1 million sounds great. Like, I'll never go through $1 million. But if you have a serious medical problem or injury, you can go through $1 million in a blink of an eye. So this is actually a huge improvement that's adding value to your healthcare dollars. But on the downside, that is insurance companies are going to have to calculate that in and think about increasing premiums. So there's that. And there's also no longer can you be denied coverage if you're having a medical emergency and you go to an ER that is out of network. There's going to be one marketplace in which you can shop for different kinds of plans. And by having this, it allows you to compare all the plans and helps push insurance companies to be competitive. No longer can insurance companies take away coverage for an honest mistake on your application. So in the past, what could happen would be like, let's say you're having a healthcare issue and you really need your policy to help you out. And your insurance company looks at your application and says, oops, I see here that 5 years ago you were on such medicine, or you had such and such medical problem that you didn't report, and so we're not going to cover you anymore. And also, you now owe us all the money we spent on your care, which is just an awful situation to be in, and one that the Affordable Care Act is going to prevent. So again, that increases the value of your plan. And now everyone's going to have a right to appeal, and women don't pay more than men for their premiums. So ladies, even though you might not have equal pay in the workplace, there's now equal pay in healthcare premium costs. So some of the trends that we can see from these facts, that is, there is a value component. And ladies, I'm sure you understand that your budget for a purse that's brand name and very exceptional quality, you know, you're going to be willing to pay more, especially if it's on sale, for that brand name product that has more value than you are for just a purse that you'd find at Walmart. So, you know, because of these values, you know, most of the experts agree that, for instance, probably premiums will be increasing for young people. But if you see that, keep in mind that also the value of your healthcare plan has also increased. And again, that 4% is a very promising sign, you know, that we've had this increase in value and that has stayed on the relatively low side of the running average. So another trend that we can plan on seeing in the future is wellness plans. One thing that has been happening is that employers have been putting more of the cost for health insurance onto their employees. So employee share premiums increased 8.7% between 2012 and 2013. Over the past 5 years, the employee contribution to healthcare increased 42% compared to only a 32% increase for employers. And also, employers are afraid of the PPACA tax that's going to go into effect in 2018, and are looking at reducing their kind of more expensive healthcare plans, and again, putting more of this cost onto their employees. Now, in essence, that tax was created to force employers to be more proactive in reducing healthcare costs. And that is why we're going to see a trend of wellness plans, incentive programs that help employees to stay healthy and make good lifestyle choices, and even possibly some penalties for employees that make unhealthy lifestyle choices. So expect to see this trend, and expect to pay more for your care. No longer are you going to see plans where there's no deductible. Okay, so as a consumer, you're going to have to pay a greater share of the cost for your health care. And this is a trend that likely would be happening with or without the Affordable Care Act. So, with that being said, in that we've discussed, and a lot of the changes that we're going to come to see in the future, know that Bridges to Patient Empowerment, the nonprofit that I'm affiliated with, will be there to help you reclaim your care and help you develop wellness plans and be there every step of the way in this process. Thank you. Good night.